Welcome, readers. Today, we are thrilled to have Dr. Julie Wilson with us, a family physician, entrepreneur, and a trailblazer in healthcare innovation. Dr. Wilson is the founder of Terra Nova Medical Clinics. Her dedication and overall, her dedication is compassionate to create a quality improvement, has touched over more than 50,000 lives and earned her numerous accolades, with numerous accolades in her name, including being named one of the WXN Canada's 100 Most Powerful Women and a 3-time Stevie Award winner. Dr. Wilson is a name for healthcare. So, Dr. Wilson, welcome to Magazika.
Oh, thank you so much for having me. It's my pleasure.
Okay. So we will start with the first kind of understanding your very excellent and I would say philanthropic journey. So can you share your journey from being a like a family physician to becoming an entrepreneur and founding Terra Nova Medical Clinics? Like, what are the things that motivated you throughout this journey?
Oh, yeah, of course. So I decided to go into family medicine when I was a medical student. It's something I've always wanted to do because even though at the time people used to always ask, why family medicine? Why aren't you specializing? I knew that I wanted to have that long-term relationship with my patients, get to know them, and be that doctor that you imagine. You think, okay, this doctor can handle anything, right? Rather than just one small thing. So that's what I wanted to be. So I decided to go into family medicine. But back then, here in BC, my experience with family medicine was very traditional. It was maybe 1 or 2 doctors in a single office. They would have maybe 1 or 2 secretaries who'd been there for 30 years. The office wouldn't be well decorated, be kind of dingy. The chairs would be cracked, and everything would be on paper. So both my husband and I were in medical school at the same time, different medical schools, but we matched to Toronto to do our family medicine residency. And for us, that was very illuminatory. It illuminated a huge change in what we could have here in BC, because they had these family health teams, which are not new to them, but we have just started to develop something similar here, where we have allied healthcare professionals working with the family physicians, teams of family physicians, 10, 20, 30, 50, our clinics that we did our residency in were connected with the hospital. So you could page a specialist or get an MRI same day if you really needed to. You were connected to the whole hospital system. And you had well-paid staff who were competent and able to do very complex things. And you didn't need to do what we had to do in BC, which is what if you were sick or if you needed a vacation, you had to get a locum. So you had to hire someone to come on exactly the dates that you were not able to come, which is very difficult to do because you could have cross coverage. You were not able to be there, someone else would see your patients. And everything was on the computer or in the cloud. So there was no paper. So we came back to BC at the end of residency and thought, well, we can't go back to this old system. So we rented a larger space, built a clinic with 9 exam rooms rather than just 2 for 2 doctors. And we thought, we're going to do something like this. Now, back then, there was no primary care network where they had the allied healthcare providers. It was still that old-fashioned system, but we put everything in the cloud. We collaborated with a few other doctors. We had about 4 or 5 doctors, and we started our cross-coverage system, which was, not as comprehensive as it was in Toronto, but still quite good. And we went on like that until the pandemic. Then, during the pandemic, what ended up happening was with difficulty with hiring, minimum wage going up, which then raised all wages, crazy inflation, medical supplies becoming difficult to access and much more expensive. You'll have seen that many medical clinics closed.
Yeah.
Before you could be only okay at business and have a medical clinic. After that, you had to become good at business, which many of us were not. So I got my own, what I call my own personal MBA. I read over 50 business books. I did lots of practice, quality improvement projects, worked with the Division of Family Practice, the primary care networks, which had opened up, and completely transformed how I went from family doctor who happened to own a clinic to entrepreneur. And then with that, I discovered actually I could do a lot more good doing that
Yeah.
than just as a family doctor. Because as a family doctor, I was taking care of my patients, which was so wonderful. But at that time, because so many clinics closed, our clinic went from 25,000 patients to 50,000 in 2 years.
Oh, wow.
And how do you deal with that? How do you manage the health of all of those
Yeah.
people, making sure they have their preventative health care, get to see someone in a timely fashion? That's very difficult. Um, so I threw my whole heart and energy into that, and I wanted to do it properly, ethically, compassionately for everyone involved. So we did things like add extended medical dental for all the staff, raise their wages. We added 100% top-up maternity paternity leave for 1 year. There was supposed to be something called pandemic pay, where the government was going to pay them an extra
Yeah.
$4 an hour. And then they decided last minute to not do it for outpatient. I paid them that out of my own pocket. I tried to do things where I think, where will I look back and feel that I was a good person, that I don't want to have any regrets? And that's what I did. And turned out a lot of people were attracted to this, right? My best recruitment strategy was just to do a good job. And we added more and more people to the point that now we have 7 clinics. We 7 clinics. I've hired for them. We have 29 family doctors, 11 nurse practitioners who have their own practice, 11 allied healthcare, and we're just expanding. I interview people almost every day, and I'm going to add more and more sites. It gives career progression for our staff. It allows us to use economies of scale to provide way better services to the people we have. And again, now we can get rid of that pain in primary care. No coverage, no sick days, no vacation. We're able to do all of that. My dream, 10 years later, is now finally realized. And I'm so proud of what I have done and what the team has done. And I plan to keep on expanding that way to give that kind of experience to rebuild the primary care system in my own way, at least.
Oh, definitely. Two things, like it's a fascinating journey. Like I know you have like kind of contained the ocean in a cup, like
Yes.
your whole 10, 11 years of journey and your whole residency, and before that, your whole medical school training and everything. But I was really attracted to the three words you used, ethically, passionately, ethically, competently, and passionately. And more of the thing that you said that your personal MBA, I think that's the best way. Because what MBA school does, because I'm from a business school and my specialization is in HR,
Mhm.
nothing nothing works better than your life experience. It's always better. The confidence that you are showing in your this describing this journey, it is not from like a professional business school. It is your own personal MBA. Trust me, I have seen this. I talk with all my like clients, and whoever done very good with the business degrees, they are all having their own personal MBA. So you are absolutely on the right track on that.
Oh, thank you. I think it's like you learn something and you immediately implement it.
Yes.
It's
Yeah,
like you're practicing as you go. It's not
exactly.
theoretical. Yeah.
So, what is the specific one, two things that inspired you to transcend the traditional medical clinic model and create this, I'll call this like a nexus of one-stop
Yes.
solution type of thing,
Yes.
a medical excellence, and with this compassionate care? I really like the word
Mhm.
because I'm a big fan of Brené Brown. I'm a big
Oh,
fan
yes.
of, yeah. So this compassionate, the word you used, I'm just immediately like, oh, this is my thing then. So what are the one, two thing that inspired you to shift from this traditional medical clinic model and this nexus of medical excellence and compassionate care, please?
Honestly, I think it was frustration
Uh,
because what I wanted was to have a good job, and I want people around me to have a good job, and I want the patients to have a good experience. And just with the way the system was, that wasn't happening. And I thought, well, it's not that hard to do. If every new entrepreneur thinks it's not that hard to do, of course it's extremely hard. But um, you jump into it, you get started, and then you just keep fixing things one at a time, and it gives you a bit of a rush. Oh, I fixed that. Now that's better. And then you just keep doing it times 10,000, and then suddenly you're where you want to be.
Um, Easily I can summarize the word order out of chaos
Yes, that's
kind
right.
of thing, order out of chaos with a lot of touch of compassion and care and service mentality that I'll serve people. Yeah. So tell us a bit more about your whole this dream project, Terra Nova and everything. How does like not in exact in an operational sense, but kind of in a mission vision statement, you can go to operation as well, that how does Terra Nova Medical Clinics innovate and elevate, I'll say both, innovate and elevate the standard of medical services to make quality care accessible and inclusive?
That's a great question because that's something I've been currently working on. So I'm trying to do
Oh,
this new thing, which is not done anywhere else in BC that I know, but I'm sure it's done in other locations in the world, is I'm trying to make all my clinics talk to each other. So my vision is to build a network of clinics so that we are essentially one overall organizational structure and clinic
okay.
with multiple locations. So that way we can service people where they are, just say in Langley or Squamish, but rather than those patients only having the power of 2 or 3 doctors or nurse practitioners to care for them, they have the power of the entire team and the entire administrative staff. So if the IT goes down, we have an IT person, which then improves the care for the people in that Langley clinic who could otherwise not afford such a high level employee or admin staff. Or if those doctors are full, during flu season, it can be very full. Well, we'll have somebody in Richmond or Vancouver who might be able to talk to those patients on the phone at the very least, or if the person is traveling, they could be seen in person at the other clinic. And then everything that happened would be in the chart. They would be able to read the patient's entire history. So that would provide what we call continuity of care, rather than at a walk-in where they say, what are your problems? And they're trying to get everything done in a 10-minute period. They'll be able to read everything. And then your primary care provider would be able to look back and see what was done, see all the tests and the results. So that is my vision for what I'm doing. And I want to continue to expand that. Now, that obviously has excellent benefits for the patients. It has excellent
Mm.
benefits for the staff because it allows career progression. One reason that medical clinics often don't have good staff is because it's a dead-end job. You just sort of get that job and then that's it. Whereas we can have people move up within the ranks of the organization,
Oh,
and that improves the quality of care. And then the other thing is benefit to the healthcare providers, because again, that just improves their cross coverage. Also gets other ideas. When your patient sees another doctor or nurse practitioner, you get their opinion on things, right? So we can, get sick, have a baby, go on vacation. Again, these things, they sound very basic to other people, but these are things that were not possible for family doctors before to do.
what I'm
So,
sensing, yeah, please.
no, so go ahead. Go ahead.
No, please, you finish first. I'll be, so what I'm sensing is that you are turning a very mechanical structure of very linear service providing structure into a very organic, multifaceted service with a blend of career progression for the health service providers.
Yes, that's right. That's right.
Okay.
And one thing I also do is I add as many technologies as I can to make it possible.
Oh,
So there's not that many technologies that are available in Canada, but whenever it comes out, I always give it a try. So for example, right now we're trying AI eFax management. So that way things can get uploaded really quickly into the chart. So you're not waiting half a day for a chest x-ray or some other report to come in. So we're working on that. But we have other technologies where you can email the patient confidentially straight from the chart, send them their results. They
okay.
Also, we switched to e-faxing so that nothing ever gets lost. It's all straight to the computer. We've done things so that everything is in the cloud, so that if you're working from home or remotely, you can be just as effective as if you were personally in the clinic, right? We have online booking, we have billing supports, you name it. As long as it's available, I add it to the clinic. And again, that improves patient care, right? Because if everything is done by a human being, there's a certain error rate.
Yeah. So one of our professors used to say that AI is not exactly artificial intelligence, it is advancing intelligence.
That's right.
So
Yes.
your services are huge and hugely added by, and this AI thing, it's really fascinating. Trust me, you are one of the first doctor in Canada we are speaking that has already incorporated AI. You are the first.
Oh, really? Well, we have AI for lots of things. We have AI recall the patients. So it knows when you recall the patient, it messages them at a certain interval that we've specified, and it knows if the patient has booked back. And if it hasn't booked back, then it keeps messaging them to make sure that you don't just call them once and that's it. You make sure that they
Oh,
actually book back to make sure it's done, and that the AI monitors that. Other things we do is I offer to everyone AI note making services, because you've ever been to a doctor where they're typing and typing and typing and typing and they can't even look at you? Well, it's hard to switch your attention back and forth, but they don't have time to go after and type. So what I do is I have they're legal, they're confidential, but they listen, the AI listens to it, writes the whole note for you, so you can just talk to the patient and focus on them and do better, more compassionate care. And I give that to everyone too.
you just given me one of the highlighting quotes from the interview. You just given me that, and it's like whenever I was listening to you, it's a clear Instagram moment, like a clear.
Oh, thank you.
I can visualize my design team. They're crazy about it. So, what are this? What are some? Let's come back to the like the nitty gritty of the journey. As you said, entrepreneurship sounds very easy, but hard to do. Trust me, we are just experiencing that. So, what are some of the challenges that you faced while expanding Terra Nova Medical Clinics? And how did you overcome that? Whatever you want to share, please.
Well, there's lots of things that are each, as you know, you learned HR, right?
Yeah.
So a person can't just go hire someone and be as good as someone who actually learned about HR,
Yeah.
right? But we think we think we are at first, and we learn over time, oh, actually we have to make this adjustment, we have to make this protocol. So each thing that we learned, each thing that just say that there is a degree for, I had to learn separately, like HR, marketing, IT, etc. All of those things we had to learn from scratch,
Yeah.
right? Each was a complex and long journey. And another thing is, it's not like we run on high margins. We don't have the money to necessarily call someone in to fix a printer. If we have to, we do, but sometimes it costs us $500, $1,000, and that's our entire profit for the month, right? Especially when we were getting started.
Mm.
So there's lots of times, well, just like any business, right? You're losing money, but you have to keep the faith, right? That
Yeah.
it will get better,
Yeah.
right? So that can be emotionally difficult. You sometimes think, what am I doing here? Like, is there a purpose to what I'm doing? And then you have to go back to your vision, give yourself strength from that, and then move forward. Luckily, I'm advanced enough in my entrepreneurship journey that I don't struggle with those things anymore. But at the very beginning, it was hard to do double the work of someone who's just working in a walk-in clinic and then pay more money for that privilege, right? To
Yeah.
get that done.
Yeah. I think you can envelope all the skills and everything and all the journey. In my idea, it is resilience. You have to be very resilient, very, very
Mm-hmm.
resilient, and like you have to a shock absorbing mechanism, because first
Yeah.
at the very beginning, whatever you do, it comes back to you. Like, and most of the
Yeah,
time, it doesn't produce the result. So
that's right.
you have to absorb those shocks. Like we are doing it right now. So yeah, it is sometimes like really, really tough. Yeah. So you have already like what are the practical strategies for the I'm talking from the patient's perspective, or the service who are having the service from you, or what are having the medical advices from you. What are some practical strategies usually, like in a very nutshell? Our readers are coming from all cohorts and all demographic sections. So practical strategies for maintaining good health that our readers can incorporate in their daily lives, like really like things. Yeah.
Very practical. Well, I mean, everybody's health is different, so it depends on their personal health conditions, but very generally,
Mm.
exercise, at least 150 minutes a week of moderate intensity or greater is recommended to prevent heart attacks and strokes. Also, it will make you feel less tired. We have a chronic fatigue problem, I think.
Yeah.
Not chronic fatigue syndrome, but people are chronically tired. They're chronically not sleeping well. I see this in my day-to-day practice. So I would say sleep hygiene and sleep protection. I tell all my patients, you show up for work on time. Why don't you show up for yourself on time and go to bed at the right time, right?
Um,
So
a good
you don't
one.
say, oh, I had to do my dishes, so I didn't show up to work on time. But you'll say that for yourself and not go to sleep, right? So those sorts of things. Otherwise, I would say keep your preventative care up to date. That I think has been very lacking in family medicine, even though it is our mandate. It's because we're so tired and busy with all of the appointments. We're so backed up. It's hard to take time to say, you're due for your bone mineral density scan, you're due for your stool sample. And that often gets behind. And I find people don't have a strong awareness of their frequency of preventative care treatments and which ones are recommended. So that's one thing I'm very proud of. I personally hired a nurse out of my own funding, and I got her to catch up all my patients on preventative care. But it's a very rare thing to do. So I would recommend that for patients for cancer prevention. So that would be mainly mammograms, stool samples and colonoscopies, pap smears. And then, of course, vaccinations. Most people are behind on their tetanus vaccine, their HPV vaccines, pneumonia vaccines,
Yeah.
shingles vaccines, those sorts of things.
That's a that's a great thing, because this I didn't know this term, that 150 minutes per week. That was kind of a new thing for me, and it sounds very logical, very, very logical. Like, even if I divide it 30 minutes, it's 5 days a week.
That's
So
right.
it's very, 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 very logical and very, very doable. Thank you for saying that. And so, in relation to that, let's unpack this idea a bit more. That one thing in the medical service is that, as a patient, I'm having the medical advice for my disease or for my ailments that I'm having. But another part is that what you have just said, can you just please stretch on that point a bit? It sounds very fascinating. Your approach in patient education and empowerment. Can you share some of the success stories? Like, very.
Oh, yeah. Well, there are preventative care guidelines. And back in the day, when I first started, we actually did have more time with patients because there wasn't such a demand for appointments. And you would see the patient, they would come in with a cough or cold. And while you were there, you'd be looking through the chart and you'd say, hey, by the way, I noticed you're behind on this test or that, and let's talk about it. And then people were generally quite caught up through that chaos method, right? But it happened. Now, there's such a shortage of family doctors and nurse practitioners that when you come in, it's just so hurried that the doctor generally doesn't have time to go through your whole chart and see what you're missing. And I find that people can be quite behind. So what I've done is I've trained my staff, I've trained my nurses, I've trained myself to make those adjustments to make sure that it's done. Now, some of the success stories I've had would be essentially for all these cancer screenings, I have caught so many pre-cancers and cancers by just saying, hey, I noticed you're overdue for your mammogram. Do you think you could do that? I noticed you're overdue for your stool sample. So many. Recently, I started catching up on my bone mineral density scans for my patients, and we called everybody. We went through thousands of charts. We did a chart review that took probably hundreds of hours, right? And we went through them. And I have, in the past year, caught probably 50 cases of osteoporosis in my patients that
Wow.
otherwise would have been undiagnosed.
Yeah.
And that just took a lot of will and time and resilience and the
Yes.
belief that it was important
Yeah.
to do that. But otherwise, it just doesn't happen organically the way it used to. Although I think it's getting better with a new payment model for family doctors, you're also paid for administration time. So I think doctors may be spending more time able to do that chart review and spend more time with patients.
Sounds like really fascinating. And your conversation on this particular thing just reminded me, prevention is always better than cure.
That's right. Yeah.
Prevention is always better than cure. And you've done it, like, as I said, you are really living up to those 3 words you have said, like compassionate care and everything. Thank you. And from your, let's like go to a bit more different direction right now, because we will come back to it again. From your profile and from your LinkedIn posts and everything, it sounds that you read a lot.
Yes, I love to read. I'm in my library, one of my libraries right now. I have books.
Yeah. I can see that. I can see that. Yeah. So what are some of the books that you suggest? Maybe on health, maybe on overall life, overall happiness to our readers.
It depends what you're looking for. I mean, one book that I tell everyone is Crucial Conversations. It's a very simple book, but we all have conversations all the time. And it basically is, I tell most people, a life-changing book teaching you how to just get through difficult conversations and move forward, right?
Okay.
And interpersonal relationships cause people a lot of stress, I
Yeah.
would say. I see that a
Yeah.
lot. And that kind of stress affects their health. Like, right, people sick leave, they have to leave work, they feel unwell. So that's one thing. I have so many books that I love. A great one for depression and anxiety would be Mind Over Mood. It's recommended by
Oh,
most.
fantastic book. Yeah.
Yeah, it's a fantastic, really.
Fantastic. Yeah.
Um, I recently read one called Rewire Your Anxious Brain, and
Oh,
it goes into, the chemical basis of anxiety. And I think it helps patients a lot to know where it's coming from. Now, for general health, I do not think I have found one good general health book saying this is how often you should do this and this is how much you should exercise. I find a lot of them are very opinion based. I was
um,
thinking some family doctors should write just a very basic evidence-based health guideline book to read. They're either like a textbook or like a social psychology, personal opinion kind of book that I find in the health section.
maybe in coming times, managing all your like engagement and everything, you should plan to write one.
Yeah,
No,
maybe when
seriously, because the experience that you have both end, like as a direct medical practitioner and how to turn it into a very service-oriented business. So you have seen both of the boards, so you can cover a lot of ground, and like unique. You are in a like a unique position to write it. So maybe like make it in a very include it in your bucket list.
Yeah, okay, I'll put that
Acceptable.
on my bucket list and I'll just Amazon self-publish or something and give it out to people.
Oh,
But
there will be a lot of publishers to publish your book. Trust me.
BC has done a great job with their government health websites. I don't know that, like, I usually just search it, but they have a lot of health information online.
Okay.
And I find that that's a great resource for patients as well. All of that information is available on their various websites.
Our readers in BC, please
Yes.
listen to Dr. Wilson, please, and go to
Yeah.
BC website, BC
Yeah.
government website. Yeah. No, thank you for the input. That these are the information that our readers are from across Canada, so they'll be really helpful. And there are so many people these days, as you know, are moving out of Toronto for many reasons and everything. We are not going into that, but moving Toronto from BC, and they're also coming into BC, so they'll be really helpful by your
Yeah.
suggestions.
In general, the guidelines are slightly different from location to location, but they're broadly the same,
Mm.
right? So I would say probably each province would have it, but even if not, even if you're reading from Manitoba, you could look at the BC website. I'm sure you would find it very helpful.
Okay. You have already touched upon our next question, and how, like in a very briefly, if you can, because you have already touched it. I will go to expand it a bit more, because how does technology play in your clinics? So you have talked about AI, and has it improved patient care, one or two dimensions, if you like to
I would
mention?
say so much, so much. There's a number of things that have been huge problems, in my personal opinion, in healthcare. One is that we have to use facts. Facts is confidential, but it also means that many things get lost. So if you're changing the toner, the facts that would be coming in at that time then goes missing. So many years ago, I switched to e-faxing, and I think many clinics have slowly started to do this over time. But we've all heard from patients, the hospital didn't receive that requisition, my specialist didn't get the referral. It's quite common for these things to go missing. But as a family doctor, you get every report and every result that ever happens to any of your patients. So if any of that goes missing, you could miss a cancer diagnosis. So technology, I think, has come a long way to reduce a lot of those errors that can be quite dangerous. So that's important. Other things, our patients are way more educated than they used to be. So they want to be educated too. So when they get reports, they often want to have a copy. Now, you can get your Life Labs results online, etc., but not everything you can get online on your own. So you have to go to talk to your family doctor to get it. And we used to just print things and give it to them, which was not only a waste of paper, but had a risk of being lost, and that the confidentiality would be lost. So one thing I've added is confidential emailing straight from the chart. So you can send them all of that information. You can write them notes and it's confidential, and then they have it in their own system, right? So they can't lose it. And as I said, the AI makes a huge difference. When I can look my patient in the eye the entire visit, it changes your experience to the point that previously I felt like overworked and stressed out and lack of human connection during my patient appointments. And now that is back. And I feel much more connected to them and much more human. And I'm sure they feel that as well.
Yeah. I mean, you're sounding well, like exactly, you're like resonating very much with one of our prof in U of T. She used to say that we are human resource specialists, but we more focus on resource than human.
Yes.
So
Yeah.
human is lost from the equation. So whenever you're saying that, to look at the patient for a longer period of time makes a huge difference. As a patient, I cannot say how important it is. Like whenever I see that my doctor is paying attention to whatever I'm saying and everything, like it cured me, like a part of me and part of my disease at that very point. So it's like very, 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 very important. So thank you very much for sharing that. What are your insights? Oh, sorry. Okay.
Coffee.
No, it's okay. No, it's okay. Fantastic. It suddenly made the whole conversation very warm. Thank you. Thank you for doing that. And I was really hesitant, like, oh, you are like, I didn't see you. So should I sit with a cup of coffee and everything?
Oh,
Would you mind doing anything? No,
oh
I
no,
was like, your
you're
profile
back.
and everything, it's so big and everything. So
Oh,
we were like, yeah, please. No, I had one before, just like before the interview starts. So I wanted to give you the like full attention to the conversation, not it. So please be comfortable. So can you share some of the insights that the intersection of health with the industries and technological innovations? Like what are the intersections according to you? Because you use a lot of AI and other technologies, you will be the better person to, like a vantage point view.
well, technology in medicine is a hot topic. Everybody wants it, right? We often say that doctors will be replaced by AI, and a lot of people feel sad about that. I say, please give me an AI that does all the work. I just talk to the patient, and then I say, yeah, AI, you did a good job. Thank you. But uh, I think that the technologies for medicine in particular, they're going to be coming hot and fast, and I'm excited for them. Now, the key with them is rather than them just appearing, we actually need them to be legally certified in each country, right, or each jurisdiction. So like in Canada, so it has to have special things, like it has to have certain confidentiality requirements, right? And depending on what it is, it has to be perfectly robust, right? Like you can't have a certain error rate that you might have in other industries, right? If you get an eFax or AI, like we tried, for example, an AI fax management, but its error rate was something like 5% because we were having a human check it. And we said, okay, we have to stop and wait until technology gets better, because it needs to be close to 0% in medicine, right? So there are certain things that make it more difficult than other industries. But on the other hand, I think there's so much drive to do it that in the next 5-10 years, medicine is going to become unrecognizable to how it is now. And I'm excited for that. I want it so badly.
Okay. I'm not trying to like tell you to do a future prediction or something, but what are the sectors, according to you, will experience those changes? Like in your, like, it's kind of an educated guess.
Okay, so note taking, that's already taking off, right?
Okay.
So
Note taking means whenever the patients are saying anything and doctors are taking note.
that's right.
Okay.
So
Okay.
it
Please.
takes up more than half of our time to do that.
Yeah.
Right? So cutting that out allows us to not only do better patient care, but save time, but also write better notes, because AI has time to write 3 pages based on what I talked about, whereas I would just write 1 paragraph on what I talked about, right?
True.
And then my AI also does things like compile that note, make a summary so I can email the patient. So then the patient doesn't have to take notes, can focus, but also has a complete description of what happened and what the recommendations are. So that sector, because large language models are actually probably the most advanced things currently in AI, that's easiest for them to do. And then again, anything that has to do with reading a document and putting it into charts, I think AI will be able to do that and manage that, because again, that's language models, although it's not quite there. Ensuring scheduling, that AI is really important for that, like with our recalling system. But so far have not seen much else. You know, for clinical reasoning, they keep saying, oh, you know, ChatGPT is better than a doctor, but I haven't seen that. I haven't seen it because, yeah, if you put in a perfect textbook case, yes, but talking to a patient is very complicated and they don't give a
Yeah.
perfect history. So if you put that into ChatGPT, it just comes out as nonsense. So I think in the future, that would be the next thing. That's what everybody wants, but it's currently not there.
Okay. Hopefully it will be there. But by listening to you, I think whatever makes the difference is that even if two patients are coming with exactly the same disease to you or to
Yeah.
your clinic, but their lifestyle is different.
Oh yeah, that's definitely true. You have to talk to the patient. And that's why it's great to be a family doctor where you know them. You say, hey, I know that you love to run marathons. So
Yeah.
I know that the exercise component is already taken care of. So let's talk about these other things. Or some people are averse to medications. Some people love medications, right? And you can talk to the patient based on their personality, their goals, their lifestyle. Just say you ask someone to do something, but actually they're a caregiver to 3 elderly relatives. It's not possible for them to do a lot of things. And you have to work with them around those factors. And I feel like half the time I'm doing medicine and half the time I'm just doing brainstorming around their lifestyle to make it happen. And we sit and we talk about it. And I don't think AI can necessarily do that yet. Maybe in the future.
Let's see, but there will be a human touch always necessary, always. They say it for the teachers as well, because I teach in colleges as well. They say that teaching will be replaced by AI. I said, yes, in the content perspective, but delivery is always individual. It's always human.
And we all know
So,
if you're in an in-person meeting, you pay more attention than if you're watching in a Zoom meeting, and then you're paying more attention than if you're watching a video. And if someone just gives you paperwork, you're probably not paying attention at all.
yeah,
So there's something about humans being socialized that if someone is sitting directly with you and looking you in the eye and saying, I think you need to exercise 150 minutes a week,
yeah,
it has a much greater impact. Actually, you can see this in studies about smoking cessation. Everyone knows they should quit smoking.
okay.
Everybody knows that. But even a 5-minute talk by your family doctor significantly increases your chance of quitting smoking in the next few weeks.
Oh,
Because there's something about that human interaction, somebody talking to you and telling you, you already know it,
like
but it makes a difference.
like through evolution, I think we are more wired in face-to-face conversation than in any other type of communication system.
I think so. Yeah.
Yeah, I'm like, no, it's my hunch because I'm not no specialist in that. But whenever we say, because even for the note taking, you just said that. So I was very recently reading a fantastic study that while taking notes, if you are more engaged in the conversation and face to face, or you're listening face to face, it creates more impact. So that exactly resonated to what you said.
Yeah.
It
That's my
is fascinating.
experience.
Yeah, no, it is fascinating. It is fascinating. So very quickly, you have said some of the health advices and everything, lifestyle changes and everything. So we are not again going into that. So how do you see the future of healthcare while including the most of the population? Like relation to like from the inclusion perspective, those who are like socioeconomic ladder, those who are
Yeah.
not well off and everything. So there is a challenge. There is a challenge in every system. But how do you see? Because you have kind of, as I said, you have seen both sides and many sides of the table, and you have seen almost all sides of the conference table. So entrepreneur, medical practitioner, family doctor. So how you see that future that we are including the most number of people in the most accessible way. How do you see that?
I see wonderful changes in that. Wonderful. So in BC, we've created the primary care networks, which is based on a geographic location. We get funding and then allocate resources. So for example, in my own clinic, we have free for patients, social workers, occupational therapists, chronic disease nurses, counseling. There's also access to the frail seniors team and physiotherapy, et cetera, and more, right?
Mm.
And a lot of times you would have a patient of, limited finances, and they would say, oh, I need to get this taxi credit and I need this form and I don't know what to do and my housing is gone. And you're trying to figure out as a doctor, but you don't really know and you're just Googling. Now I can send them to the social worker who actually knows, who can help them with that, right? Or, people find medications very expensive. So talking to the chronic disease nurse and the dietitian about how to manage their health conditions through lifestyle can help a lot. But also people of low socioeconomic status may not be able to afford their own version of that, right? Pay for your own dietitian, for example, right? And also they can talk to you like, okay, I know you don't have a lot of finances, so let me find you a diet that you can buy more affordably that's still healthy. Otherwise, you're getting things like eat liver and spinach for your low iron and, eat mainly vegetables, but vegetables are so expensive. How do you do that? Right. So a lot of those things are beneficial, and more of those resources are coming out with time, which is really fantastic. And other things that are beneficial is that, and I see this in I love to train medical students, but, you see them, they get a lot of this training that we didn't have about diversity and inclusion. So they come in much more sensitively. And then with the new payment models of having more time with the patient, getting to know the patient helps you be more sensitive to them, know what's going on in their life. So I find that is a huge change. And also getting rid of the sort of the walk-in component. It was always very crucial for people to get in urgently, but having a person who knows you well, who is your family doctor or nurse practitioner, I think is one of the most crucial things you can do to feel heard in medicine and feel respected. So that's one thing I'm trying to do to add more and more of these providers to the system. It's one of my big passions, actually, hiring so many people so that people can have that personal connection and they're not just trying to explain themselves every time. Because a lot of times people who have poor education or have poor language skills in English or French would find that they can't communicate their health needs very well, and then their health outcomes suffer for that. But if somebody knows you well, then I think that you can get past a lot of that.
Yeah. No doubt about it. No doubt. Fascinating. Very quickly, one last thing. You're so passionate about providing service in a very caring way. So what steps are you taking to promote women in healthcare, and what changes would you like to see in the industry?
Oh, I could talk to you about this forever. Forever. Okay, so
we will have another interview session on this. Okay.
This is the #1 book everyone should read, called Invisible Woman.
Oh,
How data bias in a world designed for men harms us all.
Fantastic.
So that's an amazing book. But essentially, if you look at, and recent studies and even winning the Nobel Prize in economics recently have shown, and I'm sorry about the dogs there, have shown that
no, it's okay. They're fine. They're fine. I'm enjoying.
one thing that creates the gender pay gap is that even if you have the same training, lawyer, right? Most women throughout their lives cannot work a 9-to-5 job, right? Because they have stuff to do, right? They're the caregivers for children.
They're the caregivers.
Right? And then because of that, they'll choose a job with greater flexibility. And then those jobs with greater flexibility often pay less, even though it's the same training. So one thing I tell everyone in my clinic, they ask me, what hours can I work? I'm like, whatever hours you want. Well, what are my requirements? Whatever you want. I say, as long as you keep your college guidelines, you are keeping to the ethics of your profession and not doing anything wrong in regards to that, you're a fully grown adult. Do whatever you want and I will make it work for you. And most of them are extremely surprised by this, which is sad. It is sad because there's no reason a clinic should be open from 9 to 5. Why can't somebody work from 8 p.m. till midnight, or from 6 a.m. till 10 a.m., or just come in for an hour or leave to pick up their kids from school? The fact that there are restrictions, even at this highest level of education, when there shouldn't be, means that women cannot succeed. So I try and take everything that I've ever heard about that prevents women from succeeding, which is mainly a flexibility thing, and I just make it a non-thing. I just make it disappear for them. And they're very happy. And
it's
you know
out
what?
Of the, yeah.
Men like it too, actually, but they just haven't been necessarily brave enough to ask for it or adjusting their lifestyles, right? But men also have greater caregiving roles. They want to be better parents, etc. So it's good for everyone. I don't just only do it for women, but definitely it's a bigger concern for my female colleagues and for my front desk staff. and all my admin staff, I give them 100% top-up maternity and paternity leave, because I believe that's a huge factor, you know, and I pay that out of my own pocket, right? Because I truly believe in it. And then other things would be, you know, working from home. I try and make it as easy as possible from them, because if you have kids or you need to do things, you need to be able to work from home. And I, again, invest in those resources to make it equally efficient. So I also do a lot of quality improvement projects. So if somebody brings up a concern or something that they need, I just work on it right away, because everyone's story is a little different.
Yeah. No, definitely. Yes, everyone in the family, both of the husband and wife or partners, or they're both caregivers. But over my experience, whatever I said in the business sector as well, you are saying the medical sector, and from my own social experience, women are primary caregiver.
Yes. Yeah.
They're so close to. That's why we call Mother Nature.
Yeah. Yeah.
There's a reason for that. We'd never called Father Nature.
We can. I think societal pressures have put it that way, and I think there is a shift.
Yeah.
But you know, I think we just need to break a lot of the 1950s work restrictions that were based around men's
For
lifestyles.
sure.
100%.
For sure. Yeah.
Oh, there's a baby here. Sorry.
For another thing. Oh. We have a future podcaster.
Yeah, this is my baby Shay. He's a year and a half. Say hi, Shay.
Oh,
Hi.
my name surely resemblance to you, have a very strong resemblance to you. It's it's okay. It's okay. It's absolutely okay.
This is what it's like to be a working woman, right? And we need
Yeah. And always, these are the challenges that moms, especially with like kids, like no, I always say non-school going kids.
Yes.
It's a huge challenge. I have seen my wife, I have seen my sister, and I can't recall my mom's, but then she was in Germany and all. So yeah. So these are the things. Thank you so very much for being such a wonderful. So whenever I always tell, so let's first formally finish this. So thank you very much for being with us, and thank you so very much. And I really hope and pray to Mother Nature that this is not the last conversation we are having.
Well, I would love to do it again. It's so fun.
Yeah. Thank you so much.